My name is Wendy Graham. I'm the Professor of Obstetric Epidemiology at the London School of Hygiene and Tropical Medicine, and I'm the lead investigator on the BASICS initiative, the lead investigator from the London School. Some environments are more risky than others. So, for example, not surprisingly, a healthcare setting carries more risk of infection than, for example, getting on a bus. And of course, today, in the context of COVID, this issue of the environmental risk or transmission of COVID is particularly important. So when we go into healthcare facilities, there's a particular set of infections which are called healthcare associated. And what that means is actually acquired from the healthcare environment. And that includes acquired from a surface which has not been cleaned appropriately or regularly. In the case of viruses like COVID, that's a droplet-borne virus. That can be spread by contaminated hands, and a hand touches a surface, somebody else comes along and touches that surface and then gets that transmission on their hand. So in other words, hands and surfaces are like two sides of the same coin. If you're trying to prevent the transmission of infections, and particularly COVID-19, then you've got to have safe hands and safe surfaces. It doesn't matter how many times you wash your hands. If you're then touching contaminated surfaces, you are undoing all the good that you've done. It's like many things in the fight against disease, and in particular for infections, there's no magic bullet. Cleaning alone needs to be joined up with other activities, which are part of what we call infection prevention and control. Cleaning must happen, but it must be part of a bigger strategy of infection prevention and control. And alongside that, particularly if we're about low and middle income countries, it's particularly important that the shortages of effective sanitation, appropriate sanitation, and water, because you can't clean without water. There's no amount of alcohol-based hand gel can be used to mop the floor. So shortages of water, good clean water supply also has to be addressed. There's no point in training people in cleaning if they can't clean because there isn't the safe water. Teach Clean, it's basically a participatory training package on environmental cleaning, and it's aimed specifically at cleaners in healthcare facilities in low and middle income countries. It was developed by an organisation called the Soapbox Collaborative with us at the London School of Hygiene in 2018-2019. We were doing work in maternity units looking at generally infection prevention and control. And we found a very particular gap around cleaning, both the knowledge of the cleaners and the skills and the way they were doing cleaning. And many of these cleaners were typically had very low levels of literacy. Many had not received any training at all. Typically, they came from some of the most marginalised sections of society, so had very little authority to demand equipment, often poor rates of pay and conditions of service. And often they were exposed themselves to dangers in their job, so they didn't have gloves or personal protective equipment. They were sort of seen as individuals who just got on with what they did without training, without protection. So we realised that that was a big gap and a big need if you were going to improve infection prevention across the board. But of course, because these individuals typically are not used to going into a classroom or being taught in the normal way that we perhaps would do with formal education, we knew that we'd have to develop something rather different, something much more participatory, much more engaging, that recognised the knowledge, the skills they already had, but sought to improve them, but not in a very sort of top-down way, in a very what we call participatory way. So we designed Teach Clean to fill this gap. It was developed and piloted first in the Gambia and West Africa, but it's been used in lots of other places now. Most recently, it's been used in hospitals in Tanzania, and it's ongoing in some work in Myanmar. Both of those are countries in which we hope to work with BASICS. There are two main parts to it. There's the training modules. One is training modules to teach you how to clean. And then there's some guidelines about the way that you clean. As well as that, in that training, there's also guidance for the supervisor on how to follow up with the cleaning, because no amount of training on its own is enough. You have to follow up. Environmental cleaning is very important. Staff in facilities professionals are very, very busy and often very overloaded. And so everybody else has to play their parts. There's a real missed opportunity if you've got workers there who are trying to do their best but haven't been properly trained or empowered to do proper cleaning. They can protect themselves, and of course they have the right reliable sources of equipment, not rocket science, but cleaning science. That's $1 million question in lots of ways, because behaviour and behaviour change is at the root of many, many health problems and indeed societal problems. If only we could have a behavioural intervention to get teenagers to tidy their room, for example, or people that want to stop smoking to stop smoking. We often talk about can't do, won't do in terms of behaviour change. Can't do is when you don't understand, you've not been trained, and you don't have the equipment, and won't do is that you really are not motivated to do it. So typically we have to address both those things. So as well as the training, there are issues of motivation and self-efficacy, and we know that in behaviour change understanding, that's really important. So Teach Clean has been informed by understanding of behaviour change. There are various models of behaviour change that have been used to try, as I said, not only to give skills, but also to talk about the role of the cleaner so they understand why their role is important, why they're an important member of the healthcare workforce, how they're actually important for patient safety and health, and making the environment respectful. So their role needs to be valued. And so alongside the training of the cleaners, we also address issues of the attitudes of other workers towards them, in terms of them being seen as part of the healthcare workforce. And typically all over the world, and whenever I've talked about cleaners, people all of a sudden notice them. They've been there all the time, but typically we walk straight past them. And I know we're not allowed to hug a cleaner at the moment, that's not appropriate, but you can at least say thank you. They're often marginalised, neglected workers in both both healthcare environments and in public spaces. But they're carrying out an important job. So that behaviour change depends not only in this knowledge, so they can do good cleaning, but also the motivation by themselves understanding what they're doing and valuing what they're doing, and of course their colleagues around them respecting and regarding them as part of the healthcare workforce. And where we've done this training, there have been some very heart-rendering and really warming comments coming from healthcare professionals who would say, I'd never really thought about this. You know, these people are there. You know, I didn't realize that there was a science to what they were doing. I never thought about the risks they could be at. And there's a lot of history about the word clean and cleaning. So you have to recognize the culture in which you're trying to bring about the change, and recognize that attitudes and social norms towards cleaning have also got to be changed. And so, again, no magic bullet, but there's no amount of training if you don't take on board these other wider enabling factors that mean that cleaners can really do their job as a really valued member of the healthcare workforce. In many low-income countries, the levels of healthcare-associated infections can be 20 times higher than what we might see usually in high-income countries. So basics, bold action to stop infections. And the beauty of basics is that, well, firstly, it is back to basics. It includes very basic things like mops and buckets and cleaning. And it includes also addressing infrastructure shortages like water and sanitation. It's going back to those basic things that in the wondrous rush for more and more technology, we've forgotten some of the most basic things that need to be there and that sadly are not there. You know, things that we've known about for centuries from Florence Nightingale. Teach Clean will be embedded in every country implementation plan. The idea of training health facility cleaners and empowering them through better equipment and supplies, and issues that change the attitudes towards cleaning in the facility. So it's going to be a core part of the actions taken in each of the collaborating countries, alongside, as I said earlier, other infection prevention issues like personal protective equipment, waste disposal, etc. So it's a core part, and probably one of the most basics. Alongside, of course, anything that you do, you need to monitor. You need to make sure that things are being done as you intended and that things are not going off target. In public health generally, it's quite common for us to cause positive effects, but sometimes inadvertently perverse effects or adverse effects. So you always have to monitor to make sure things are going in the right direction. And we are also going to be able to use some very, very simple microbiology to be able to see the efficacy or the effectiveness of the cleaning. When we look to see if cleaning is working, we do simple surface microbiology, taking swabs and slides to see if we've got hygiene failures. And hygiene failures will tell you whether the intensity or the method of cleaning and the materials and the fluids used have been good enough. And the problem with cleaning, something can look clean, but it's not microbiologically safe. So as well as the training of the cleaners, we need to do some monitoring and feedback and make sure that that very target outcome, these infections in mothers and babies, are indeed being impacted upon.